All right. So we're going to start off by introducing ourselves and discussing why we applied to NHC SF. So my name's Anita. I grew up in Cupertino, California, which is about 45 minutes south of San Francisco. I see that we have a lot of people from the Bay Area here, so it's really great to see. I went to college at UCLA and majored in cognitive science, minored in applied developmental psychology and education studies on a pre-med track. And I graduated last year, participated in the NHC program during my gap year while applying to medical school. And I applied to NHCSF because I wanted to gain hands-on experiences in public health and also contribute to work being done to reduce health inequities in underserved communities. And I'm definitely also interested in urban health and definitely like being in cities. And since I'm from the San Francisco area, the location was my first choice. Yeah.
Hey all, my name is Trevor. I'm from Modesto, California, Central Valley, about an hour and a half away from here. I went to college at Johns Hopkins in Baltimore, Maryland, where I majored in the medical humanities and history. So I applied to NHC just because a lot of my undergrad work was volunteering work was focused around like the emergency department and like healthcare for the homeless. And after like a couple of years of doing remote work, I really wanted to get more involved with, just more kind of in-person community-based work like this.
Hi, everyone. My name is Michael. I'm from Seneca, South Carolina, and I went to University of South Carolina, where I majored in psychology, and I took a gap year working at an ophthalmology clinic, and then now I've been at NHC San Francisco. I applied to this location because in my junior year, I studied abroad in Denmark, and I did an internship working with a lot of drug users. And so my position now is opioid use disorder care coordinator. So I get to work with a lot of the same communities that I built relationships with before. Yeah, that's a little bit about myself.
Hi, my name is Vivian. I'm originally from the LA area. I moved up here about 5 years ago to go to school at Berkeley, graduated in December, so very recently, and then joined this term in January. And I decided to do NHC after because I've done a lot of work in the needle exchange setting, case management at county hospitals, and work around prison health and in prisons. The population that we serve at Whole Person Integrated Care at the Department of Public Health really stood out to me and was something that I saw myself growing in after graduating. And yeah.
So next we're going to talk a little bit more about our specific positions and what that day-to-day might look like. So my official position title is COVID-19 responder and value-based care coordinator, and that's a part of the San Francisco Department of Public Health value-based care team. And a quick explanation of what that means is that there's basically some quality metrics that assess the care delivery to patients in the health system. For example, percentage of patients who received the flu vaccine, things like that. So the team essentially calculates this data and uses it to drive different quality improvement projects. So my day-to-day may look different based on the projects that are ongoing. So we just finished working on some projects related to the flu, some outreach to patients to schedule appointments and actually going into clinics to help train staff in documentation for the vaccine. Maybe specifically speaking about today, some of the tasks I performed were outreach to women who are Black and African American, to schedule mammogram appointments for them for breast cancer screenings, and also performed some patient interviews. So for a project about diabetes control in patients. So that's a little bit about my service.
Yep, so my role is called the SOS and Shelter Healthcare Coordinator. It's part of the San Francisco Department of Public Health, and one of its departments, the Whole Person Integrated Care. Whole Person Integrated Care is mostly dealing with patients experiencing homelessness. So there are 3 subdivisions of that. It's shelter health, street medicine, and then urgent care. And the work that I do is mostly in the shelter health and then street medicine divisions. So what I do is I'm placed in a couple different homeless shelters throughout the city, working with the shelter health teams, which consist of physician, nurse, and then health worker, and doing a lot of, patient outreach, a lot of case management, health education, and just helping, coordinate care for patients, experiencing homelessness. The other aspect of what my service is the SOS, so street outreach services. So I also volunteer on a medical van that drives around the city, also to, just outreach people directly on the streets as well as the shelters.
Like I said before, I am an opioid use disorder care coordinator, and just specifically, I'm at Health Right 360, where they provide comprehensive care, including primary care, behavioral health, case management. So I specifically work with the medication-assisted treatment team and help with the intake of new patients. So trying to make sure their transition into detox is as smooth as possible, and then helping communicate between the clinic and the detox facility. And also some outreach here and there, seeing if people need or are interested in behavioral health services or primary care. And that's mostly my day.
My role is a street overdose response coordinator and also palliative care team coordinator. I'm over at Whole Person Integrated Care, Department of Public Health in San Francisco. And my day-to-day looks like a lot of street outreach. In terms of the street overdose response coordinator role, I go out in the van every morning and afternoon, and we kind of drive around the city, try to follow up with folks who just experienced a non-fatal overdose. And then we'll try to connect them with detox programs like the one that Michael mentioned, and then try to connect them with other harm reduction places. And we also provide support around just like peer support, helping them navigate like social supports and also case management. So any other resources that they need, we can help them connect them to our primary care provider. And I'll also work with nurses to also coordinate MAT. And then with the palliative care team role, I'll provide social and also kind of resource support to folks experiencing like an end of life care. So like a terminal cancer or heart failure, just providing comfort at this stage in their life. So I'll go out with the primary care provider and a social work, and we'll kind of outreach folks there too.
Okay, great. Next, we're going to talk a little bit about some of the other aspects of the NHC program. So some of the other things other than the service that we described in our main positions would be some trainings, group service activities that we participate in, committees. And I can talk a little bit more in depth about training activities. So we do different seminars. For example, one of the things that we're participating in now is the UCSF mini medical school seminars. There's one currently ongoing about holistic approaches to mental health and healing. So we get access to things like that. And then group service activities are things that we do with our whole cohort. So some of the activities that we've done in the past include a beach cleanup, community gardening, serving food to people experiencing homelessness, and things like that.
And yeah, typically the group services will be about once a month. Some of the other trainings that like I've received at least through both AmeriCorps, like NHC, and then also through Department of Public Health have included things like, opioid overdose prevention, harm reduction, psychological first aid, motivational interviewing, stuff like that.
Yeah, and there are also multiple committees that you can be a part of. We're all part of recruitment and engagement, but there's also communications and training committee and core support, where you focus on wellness, and I'm missing one more.
Training committee.
Yeah,
I think I
said
said that.
Service.
Service, yeah, service
Yeah.
committee. So yeah, there's something for everyone.
Yeah, most of the other aspects of the NHC program were kind of mentioned so far, like the trainings, group service, committees. I'm personally also a part of core support, so we'll try to plan events, try to get other NHC members together and kind of hang out. And yeah, through Department of Public Health, we also have a lot of trainings too. They're optional, but there are a lot that you can attend, and they're from a lot of really amazing speakers, people doing work in health equity too. So a lot of trainings around that too, and motivational interviewing.
Okay, great. Next, we are going to talk about what some of the sort of benefits that members receive are. I think one thing that comes to mind for me is that we receive transportation vouchers, which we can use for public transit in San Francisco, which is really useful. Especially for me, I live at home. Like I said, I'm from Cupertino, so I take the Caltrain up into the city. And so I'm able to pay for that using those transportation vouchers. And there's a bunch of other benefits that everyone else can talk about.
Yeah, and in terms of transportation, the transportation voucher comes out to $81 a month. You can use that for the Clipper card, which is, public transit just everywhere in SF and the Bay Area. One of the other things that we get is we got a lot of support in setting ourselves up with EBT, like CalFresh food stamps. And I think that also helps a lot in terms of, just in terms of benefits for enough food and in general support for alongside the stipend as well.
Yeah, and also with the transportation, you can get discounted Muni and BART rides with the Clipper Smart Card. Also, you can qualify for, after you qualify for the CalFresh, you can use that card to qualify for utilities discounts. So you can get discounted internet and discounted water and electricity, which helps with the cost.
Yeah, so a lot of the benefits were kind of talked about so far. I think personally, transportation benefits and the CalFresh EBT card really helps out every month. I live in Berkeley, so it's across the bridge from SF. So I take the BART and bus every day, so it really helps out because those things adds up over time. And I think there's also another resource, the MAP. You get access to a member portal, and you have access to other resources like personal assistant, life coaching, mental health counseling. I think there's a lot more. I haven't explored it yet. I haven't had time to look into it. But I don't know, maybe Nadia has a better picture of other things that MAP provides. But yeah, I think another helpful thing is also being eligible for discounts on utility or even having it free. So yeah.
Yeah, and just one more thing that I wanted to note is that the travel vouchers that we're talking about, that's NHC San Francisco specific, so that may not apply for other operating sites.
Just one thing that came to mind for me, one thing that helps me a lot from using the EBT card is it qualifies you for bike share for all. So throughout the city, there's a lot of these Lyft bike stations, both electric and normal bikes that you can kind of just ride share your way around on them. And the EBT card means that when you qualify for that program, the cost of the rides will all cap at $1. So it makes it very easy to get around the city as well. That's how I usually get to work.
It also helps with farmers markets. They'll match. You can ask for like $10 or $15 and they'll match that with like tokens, and you can, they're basically giving you free money.
Yeah, so there's a lot of things that the EBT is really helpful for, and we get a lot of support in like filing those to receive those benefits. So one of the next things that we were asked was what we do for fun stuff in SF. And I think that going back to EBT, something else that it qualifies you for is free or discounted admissions to a lot of museums in San Francisco, because there are a lot that can be kind of expensive, but it's nice that because of our benefits, we can get into a lot of them for free. So I've been to MoMA and the Academy of Sciences, and there's a bunch more. Some other stuff that I like to do is I like to go to Giants games because I'm really into sports. But there obviously are a ton of things to do in San Francisco. So
Yeah, I think for me, one of the things I like about living in SF is there's like, a lot of nature around, a lot of parks, a lot of greenery. Some of the stuff I do for fun is I go rowing. So I do dragon boat over Lake Merced. And then also I'm also part of another rowing team that rows out in like the bay itself. And that's actually with like the doctor that I work with, because he introduced me to the sport as well.
Yeah, and another thing about like the free admissions to like the museums, a lot of them you can get multiple tickets, so you can, a lot of times it's like up to 4, so you can be really popular among your friends. And I like personally to find new places to eat. San Francisco has a lot of different food options. Some of them can be really expensive, but also there's some really cheaper ones.
I live over at Berkeley still, but the thing about living in SF or being in the Bay is that everywhere in the Bay is pretty accessible. Like you can just like hop on the bar and you can go to like San Jose, Berkeley, Oakland, everywhere like that. In Berkeley, there's a lot of nature. In SF, there's also a lot of nature and really good hiking spots. I really like going to Fort Funston, one of the beaches there. It's like a cool little hiking area, and then you walk down, and then there's a beach at the end. I've really taken advantage of the free museum days. There's a cool place called the Exploratorium, and they have really cool events every day. And on Thursday, they have like a nightlife event. So they also have really cool events there that you can also go with friends. Golden Gate Park is also a really fun place. It's just like a huge strip in SF, just full of green and a lot of things to do there.
great. Now I think we had a couple more specific questions that people had submitted. So one of them was, if selected for this location, what are your recommendations for finding housing? Because obviously San Francisco can be a little bit expensive.
I guess for me, I signed up for a lot of different Facebook housing groups for like SF in the Bay Area. What ended up working for me was Craigslist. So I think because although I did have like the advantage of living only like an hour and a half away from here, I was still able to, drive out and check out the places in person. I think that also helped a lot. But for me, I ended up using Craigslist to find my current place.
Yeah, same here. I also used Craigslist and also joined those Facebook groups. I moved from South Carolina, so it was kind of important for me to have a roommate who could vet a place, because there are scams out there. So, and you also try and room with your fellow service members, people are willing to do that.
Yeah, I've been renting for a while up in the Bay, and it is expensive, but it's very doable too. Craigslist has also really worked out for me, and Facebook groups.
Yeah. And then the other question that was asked is that if you have interviews for medical school, are you given time during your service to attend them? And I'll say yes, there is a very generous personal time off policy so that you can request days off when you need them with approval from your supervisor and the NHC program staff, as long as it's done a week in advance, and you can do up to 7 service days in a row. If there are other circumstances, you can obviously discuss that with the program staff. And I will also say that depending on your host site, your hours per day, you might be a little more flexible in when you can do that. And what I mean by that is, for example, for me, when I was interviewing for med school, I had interviews for a school on the East Coast. So obviously time difference, and it was just for a few hours. So for me, it was in the morning. So I was able to do my interviews from 8 to 10 and then start my service at 10 and just work a little bit later in the day. So there's definitely time for that.
Yeah, I can add to that. I've taken a lot of time off this year, but as long as you communicate about it and have a plan for how you fulfill your hours. So if you do NHC SF, you need to have 1,700 hours completed within 42 to 46 weeks. And there are a lot of ways to get hours. You can do outside volunteering. You can do trainings that you find. And yeah, just make sure you communicate about what you need when you're applying and getting interviewed by the host sites. It's also you're interviewing them and finding out what the day is like, so you can find out more about what their hours are like.
I think one of the other questions that was asked was like, what does the timeline for the application and interview process look like? And I think obviously that's a little dependent on the person and when you apply, but there are 3 stages of interviews. There's an interview with a third-party interviewer, one with the NHCSF staff, and then one with the staff at the site that you're interested in serving at, which is what we call our host sites. Yes, so I think the timeline really can differ. I think for me it was about 2 months, but I think other people may have had different experiences.
For me, I think the entire timeline for me took about a month, but I also applied relatively late in July, like mid to end of July, and the program started end of August. So it was also on the tail end of the application process, and there weren't too many spots left open. But again, yeah, because there are 3 stages to it, one with the third-party interview, then the NHC SF interview, and then the specific host site interview. It can also vary a lot depending on how responsive each individual host site is, or how like fast they're also working through their own applications.
Great. And I think someone put a question in the chat. How have you guys grown professionally and personally from your experience with NHC? Do you work closely with mentors? To answer first the second part of the question, I think we do work, at least in my position, I do work closely with mentors. There are a lot of different physicians that I work with. Firstly, your host site supervisor might be someone that you work with really closely. For me, that is a physician who's a primary care physician who's been really helpful in kind of navigating just me learning about the health system, because it's not something I knew as much about before, but also with professional development and things like that. And as to how I feel like I've grown professionally and personally, like I said, I think that there was a lot I didn't know. I think just about the healthcare system, how people get care, all of the barriers to people getting care that were really illuminated to me through this position. And I think just having that knowledge helped, or gaining that knowledge was really helpful to me in terms of learning how I, as someone who wants to go into the medical profession and be a physician, can kind of affect change in those different areas and what I could potentially do and what problems exist. So that's how I feel like it has helped me kind of learn and grow.
I guess for me, in college, I volunteered a little bit with homelessness, but I think being able to work, serve full time in like directly within a homeless shelter, next to the shelter help team, and do a lot of like, hands-on work, talk directly to people, has helped me a lot. Like kind of what Anita said, just understand a lot of the importance of community-based health and like the importance of like, wraparound services, especially for people who face a lot of, structural and systemic barriers towards accessing just like care, and then also their housing and wellness needs as well. In terms of professional mentorship, I think for me, I work pretty closely with directly under nurse practitioners, physicians, et cetera, all of whom have like worked in their communities for decades, both with Department of Public Health and UCSF. So I think it's been some pretty good learning experiences for me, at least.
Yeah, for me, I think like Anita and Trevor, I applied to medical school. So like last year I was working at a clinic and I was a medical assistant, and this year it's more of a administrative side. And so really getting to see both sides of that and understanding, where sometimes this two competing forces might clash, even though they should be acting together. And understanding how to solve those problems. And personally, I would say that I've learned that, you can often underestimate yourself, but that you have a lot of support in the community around you. And I've definitely relied on, my fellow members and my friends and the supervisors to help me go through some really hard things. And for the second question, I would say that when I first started, I kind of started working and didn't have a close mentor that I worked with, but through working on my clinic and seeking out and talking to people at my clinic, I was able to build relationships with people. So I would say, yes, I've worked closely with mentors.
Yeah, in terms of mentors and also just like professionally and like learning more about yourself and what's out there, I've learned a lot because the teams and the clinic that I serve out of, they have a very interdisciplinary team. Like there's a dental side of the clinic, there are eligibility workers, people who help folks get connected to like Medicare or health insurance. You work with primary care providers, NPs, RNs, licensed social workers, psychiatrists, health workers. The list kind of goes on, and you're also interfacing with other city partners like homeless outreach teams. So the list goes on, and in terms of like your interests too, there's always a space for that. And I think that I really found that. And personally, the clinic and the team that I work with is relatively small. So you have a lot of time to get to know other people on the team, and everybody is very supportive. They're looking out for you and also like what you're interested in too. So it's kind of like working hand in hand together to make that vision happen for yourself. So I've definitely had a lot of valuable mentorship there. I work closely with a primary care provider and a social worker and also health workers. And I think in terms of like professional growth, I've learned a lot about like what healthcare looks like. You know, if you're interested in working in healthcare in the future, the different sides that goes into it, and like really how intertwined social factors play into health.
Okay, great. I think those are all the questions that we had submitted so far. If you guys have anything else, definitely feel free to drop them in the chat or unmute. But
I have a question. So hi, my name's Karina, and I kind of came kind of late because I had like a webinar right before this that kind of took longer than I thought. So I'm not sure if this question has been answered, but I'm just wondering, like, what do you guys think is like the biggest challenge that you face being like an NHC member?
I think in terms of the teams that I'm on, I think something challenging has been. Oh wait, is Anita frozen? I think learning how to be like mindful of how you process things in the work is something that I've had to do more often, and because you are doing kind of heavy work, you're interfacing with folks who have you know, heavy stuff going on in their life, and you're a part of that journey with them, kind of. And if you're doing like more case management too, so I think being mindful and checking in with yourself with how you're feeling has been something that I have been trying to do more in this role.
I think for me, I've kind of learned that sometimes healthcare can be very political, in the sense that sometimes when you're interacting with someone, you really have to think about what their priorities are, and when you're interacting with someone else, you know, they might have different priorities, and that can be really hard to navigate sometimes. And it's really important to just kind of build those conflict resolution skills. And sometimes you end up where nobody's happy, and that can be a really hard thing. But just, you know, keeping up hope that you can do better next time.
Yeah, I think for me, one thing that is definitely challenging, but also comes with, you know, working a lot with homelessness, is that people have a lot of these complex needs. And sometimes, you know, not just with like immediate urgent medical needs, but also like help getting linked to different housing or social services, or setting up their insurance, or getting hooked up with benefits and other kinds of social services like that. And especially with street medicine, sometimes there's not a lot of time or opportunity to be able to, you know, sit down with someone and take all the time you need to help, you know, navigate someone through this entire complex, both social and medical system. And, you know, that can also sometimes be the case with shelters too. So I think the challenge definitely comes with, you know, just having enough time to work with people, and then make sure that, you know, you feel and they feel like you've done a good job.
I think for me, it is somewhat of a combination of, I think, what other people have said. There are so many complex needs for the sort of patient populations that we're dealing with, that sometimes it's hard to, you know what to address, or feel like there is disconnect in what you think should be addressed, what they think should be addressed, what everyone else thinks should be addressed. And I think especially for me, working on kind of the more administrative side of quality improvement projects, it's kind of difficult to really see. There's so much minutia of like different details of different projects. It's kind of hard to have, one main focus. And like Michael said, people may have differing priorities. So I think his point of just having those conflict resolution skills and like being able to accept that maybe not everything is going to work out how you think, how everyone else thinks, how everyone else wants, just kind of being okay with that, I think is really important. Does anyone else have any questions? You can unmute or you can drop them in the chat.
Hi, my name is Diane. I just had one more question. So it sounds like everyone's done like really genuinely amazing work in their terms. And I just was wondering, in terms of hard skills and the expectations for this role or for your own respective roles, did you feel prepared and equipped going in?
I would say yes. We did do a lot of trainings to, start out in the role. We have NHC San Francisco trainings, then your host site will also have trainings to kind of show you the ropes. But obviously there are things that you do that won't be covered in trainings that you might not feel necessarily prepared for. And I think that's where having such a community of people that's like very understanding and really just at the end of the day wants you to learn is really so helpful. Because, sometimes I'll go to my supervisors with questions and I'll, be nervous and be like, oh, I should know how to do this. But really everyone is so accepting and really stresses the point that this is really like a learning experience for all of us. So I have felt very comfortable in, being able to complete what, my service entails and being able to ask for help when I don't really know how to do something.
Yeah, I feel like in my experience, there has been, a lot of background training that you go through before we start, the service. And I think generally speaking, in my experience, just being able to work closely with the different shelter health teams, like physician, nurse, health worker, as also like in like pretty small teams too, has given me a lot of opportunity just to have like a really good learning experience. So I haven't really felt like unprepared for it so much as like having a lot of opportunity to, learn and ask. And like Anita said, treat it a lot as a learning experience.
Yeah, I would say for me, I didn't have as much training as some of the at my host site as some other host sites, but I still felt prepared. And I think if you have to be interviewed 3 times for you to be at your host site. So by the time you make it there, you've been vetted and you're probably ready for whatever you're going to handle. You might encounter some uncomfortable situations for sure, but you're never, I wouldn't say never, but you're not in danger. So when you're at these host sites, use those uncomfortable situations to really make it a learning experience. Because this is a program that really values that learning and mentorship.
Yeah, I would say that I also felt prepared going in. And like what was mentioned before, there's also trainings that you go through before you start your host service. I think depending on the role that you apply to, it seems like maybe you'd be more on the admin side or more on the patient interfacing side and like a mix of it in between. So it kind of depends. If you're more on the patient interfacing side, I think there's a lot of resources and trainings for, like peer support or motivational interviewing, like active listening. So If you don't have much experience with that, there's also a lot of resources for that. I think to kind of go back on the last question, something that I felt challenging was learning about a lot of San Francisco resources, like where you go if you need housing, where you go if you need like shelter, food, etc. So I think that that was something that was very challenging because that's another thing that goes in hand when you're interacting with patients. But the team that you work with knows that you're there for like mentorship and also as a learning experience. So they're very open to questions and also guiding you along the way.
Great. Yeah. Does anyone else have any other questions?
I had a question.
Yeah.
You kind of talked about parts of this, but how many people or how many members are generally at each site? I think it varies depending on the site, but do you feel like you've gotten the opportunity to get to know the other members pretty well that are at different sites through more of the NHC events that happen? And then, like, are there other people at the sites not part of NHC, like through other programs that you get to know as well, or how does that sort of work?
Oh, all right. So yeah, I think for my site, my main host site is Department of Public Health, Whole Person Integrated Care. And like I said, there's 3 different branches for that: shelter health, street medicine, and urgent care. So generally speaking, there are the organization as a whole is pretty large. For I guess for like that site specifically, there's about 5 or 6 other members. And while we are placed at different sites, I'm down in Bayview at an RV shelter. Some other people are more in the Tenderloin or in Potrero Hills, stuff like that. I think there is a lot of opportunity just for cross communication. A lot of the times, I'll be escorting someone that another member can't take that day from their shelter to the hospital, or they'll take over for me on other cases. So I think there's also a lot of opportunity for within my cohort, just cross collaboration and a lot of opportunities to interact as well.
Yeah, I think like Trevor said, it is kind of dependent on your host site. For example, there are a few host sites that only have 1 member. At my host site, which is Department of Public Health Value-Based Care Team, we have 3 members. And actually there's one person who I work with very directly, and that we kind of have the same role. So there's a few positions that are like that. But I think outside of that, like you mentioned about NHC events, we do have different events where the whole cohort kind of gets together and does things. Every 2 weeks or so, or twice a month, we have member meetings. So, everyone comes together for different training activities and things like that. And we also have a core support committee, which is essentially like a group of people that their whole purpose is really to plan different activities for people to get to know each other and do things like that. So yeah, there are definitely good opportunities to meet other members, even if you're not at the same host sites. For committees, for example, me, Michael, Trevor, Vivian I'm not at the same host site as any of them, but through this, I'm able to, learn more about them. So there's things like that.
Yeah, and you're gonna see everybody for bi-weekly meetings twice a month. So you're gonna see the same faces. You're gonna get to know people. You can always reach out to people if you want to hang out. And so to echo what everyone else said, it is dependent on your host site. My host site has 4 people between 2 roles, and like Anita, I have a member who is also in the same role as me. So I see them more often than I see other people. But also, there are other people in the clinic that you get to work with, or wherever you are, and you can always reach out to people and tell them you're a AmeriCorps member, and tell them what's it about if they don't know, and they can get to know you. And something that I haven't really done, but I know that you can, they can connect you with, maybe like shadowing opportunities if you're interested in doing that. That can be part of these training opportunities, get hours. Yeah, and also doing outside service, volunteering in the community. You get to meet a lot of different people if you do it consistently.
Yeah, I'm at the same host site as Trevor, whole person integrated care. And there's like 3 or 4 other members at that host site too. I see one of them every day because we serve out of the same office. And then I also see like a couple other members here and there, just because we are also out of the same clinic, and sometimes we'll have the same clinic days, see each other in passing. So in terms of that host site, I'll see people pretty often. And then yeah, like Anita and Michael are at other host sites, but we'll see each other at monthly meetings and also the once a month group services. And yeah, like there are also a lot of opportunities to hang out with other members. But yeah, and then even since the team that I'm also serving at is kind of small, I've also gotten to know other people there too. So there's a lot of opportunities to create community here.
Great. Does anyone have any other questions about anything we've talked about or anything new? Okay, cool. If there is nothing else, thank you guys so much for coming. And I hope we were able to help you learn a little bit more about the NHC program. I can put my email in the chat if anyone has any lingering questions. If you want to reach out, definitely feel free to. And like I said, this recording should be available, so you'll be able to, go back and reference anything. But yes.
Thank you.
Thank you.